In the modern world, getting sick usually means rest, medication, and professional care. In the Middle Ages, it meant fear, not just of the illness, but of the treatment itself. Medieval medicine was a dangerous blend of superstition, religion, and blind faith in ancient texts. Doctors spoke with authority, but their methods often weakened, poisoned, or killed the very people they claimed to heal. If you lived in medieval Europe, falling ill was often the beginning of the end. Survival depended less on medical skill and more on luck, social status, and whether your body could endure treatments that today would be considered torture. For many patients, doing nothing was safer than seeing a doctor. A world without medical science. Medieval medicine existed in a world without scientific method, germ theory, or reliable anatomy. Doctors relied heavily on writings from ancient Greece and Rome, especially Hippocrates and Galen. These texts were treated as sacred truth, even though they were based on observation rather than experimentation. Central to medieval medicine was the belief in the four humors: blood phlegm, yellow bile, black bile. According to this theory, illness occurs when these fluids are out of balance. Fever meant too much blood. Depression meant excess black bile. Rather than identifying causes, doctors focused on restoring balance, no matter the cost to the patient's strength. Questioning these ideas was rare and dangerous. To challenge accepted medical doctrine was to challenge tradition, religion, and authority itself. Bloodletting, draining life to save it. Bloodletting was the cornerstone of medieval treatment and one of its most lethal practices. Doctors believed that removing blood could cure fevers, headaches, infections, mental illness, and even plague. Veins were opened with knives or leeches were applied in large numbers. The process could continue until the patient fainted. Many patients lost so much blood that they went into shock. Others died days later from infection or weakness. Yet when patients died, doctors rarely blamed the treatment. They blamed the disease, the patient's sin, or God's will. Bloodletting persisted for centuries, even as it silently killed countless people. Surgery without pain, relief, or cleanliness. Surgery in the Middle Ages was not a medical procedure. It was an ordeal of sheer terror. For the patient, it meant facing unbearable pain with no guarantee of survival. There was no anesthesia to dull the agony, no antiseptics to prevent infection, and no sterilization to protect against contamination. Every incision was a gamble with death. Patients were forcibly restrained as surgeons cut into their bodies, using tools that had already been used on countless others. Blades stained with blood, saws dulled by bone, and instruments never cleaned between procedures. Pain relief was primitive at best: strong alcohol, crushed herbs, or whispered prayers. Many patients screamed uncontrollably until the pain overwhelmed them and they lost consciousness. Amputations were among the most common operations, often performed for battlefield injuries, infected wounds, or spreading gangrene. Precision mattered far less than speed. Surgeons worked frantically, racing not against infection, which they didn't understand, but against the patient's agony and shock. A successful operation meant removing a limb in minutes, not saving a life. Surviving the surgery itself offered no safety. In the days that followed, wounds often became infected. Fever set in. Flesh blackened. Blood poisoning, what we now call sepsis, claimed countless lives. Doctors had no explanation and no treatment. Death came quietly, long after the knife was put away. Barber surgeons, medicine in untrained hands. Highly educated physicians were rare, expensive, and often inaccessible to ordinary people. Instead, most surgical care was left to barber surgeons, tradesmen who cut hair, shaved beards, and performed medical procedures as part of their daily work. The familiar red and white barber pole traces its origins to this bloody past, symbolizing spilled blood and bandages wrapped around limbs. Barber surgeons pulled rotten teeth, drained festering abscesses, stitched open wounds, and amputated limbs with crude efficiency. Their training was informal, passed down through observation and repetition rather than medical education. Knowledge of anatomy was limited, and mistakes were frequent and devastating. Patients had no legal protection and no recourse if something went wrong. A visit to a barber surgeon could mean permanent disability or a slow, painful death. Hospitals that spread disease. Medieval hospitals were nothing like modern medical centers. They were overcrowded, filthy, and poorly ventilated. Many were run by religious orders, focused more on saving souls than saving lives. Patients often shared beds. Wounds went untreated. Clean water was scarce. The disease spread rapidly. Hospitals became breeding grounds for infection, not places of healing. During plague outbreaks, hospitals turned into death houses. The sick were isolated but not treated. Many died alone, surrounded by others coughing, bleeding, and screaming. Dangerous remedies and poisonous cures. Medieval remedies were often worse than the illness. Doctors prescribed mercury for skin diseases and syphilis, arsenic for ulcers and infections, lead-based ointments for wounds, animal dung applied directly to cuts, urine used as an antiseptic. Crushed gemstones are believed to draw out sickness. Some remedies poisoned patients. Others caused infections. A few may have worked by accident, but most caused more harm than good. Magic charms, prayers, astrology, and superstition were often used alongside physical treatments. Doctors consulted the stars before prescribing medicine, believing planetary alignment influenced health. Plague doctors and false protection. During the Black Death, plague doctors became infamous for their eerie, beaked masks. These masks were stuffed with herbs meant to filter bad air, or miasma, believed to cause disease. In reality, they provided almost no protection. Plague doctors often used extreme treatments: bloodletting, cutting open swollen lymph nodes, and applying toxic poultices. Many doctors became infected themselves and died alongside their patients. Plague medicine was powerless against the disease, yet doctors continued their rituals with unwavering confidence. Women's health was especially dangerous. Women suffered disproportionately under medieval medicine. Childbirth was one of the most dangerous experiences a woman could endure. Midwives relied on tradition and experience rather than medical knowledge. Complications were common, and maternal death was frequent. Women's illnesses were often blamed on moral or spiritual weakness. Menstrual pain, infertility, and emotional distress were dismissed as hysteria or sin. In extreme cases, women exhibiting unusual symptoms were accused of witchcraft. Instead of receiving treatment, they were imprisoned, tortured, or executed. Mental illness, treated as evil. Mental illness was deeply misunderstood and feared. Conditions such as depression, anxiety, epilepsy, and psychosis were believed to be caused by demonic possession, witchcraft. Divine punishment treatment included exorcisms, confinement, starvation, and physical abuse. Some patients were chained in dark rooms or beaten to drive out evil. Many people suffering from mental illness never received care, only punishment. Infection was a silent killer. Without antibiotics or knowledge of bacteria, infection was almost always fatal. A small cut could become deadly. A toothache could spread to the brain. A simple fracture could require amputation. Doctors did not wash their hands. Instruments were reused without cleaning. Wounds were packed with dirty cloth or animal products. Survival depended on chance, not medicine. Who could afford medical care? Medical care was expensive. Most peasants relied on folk remedies, prayer, and local healers. Wealthier patients had access to trained physicians, but that did not guarantee survival. In many cases, avoiding treatment entirely offered better odds. Why medieval medicine lasted so long? Despite its failures, medieval medicine endured for centuries because ancient texts were treated as an unquestionable truth. Religious authority discouraged experimentation. Education was limited to the elites. Human dissection was restricted or forbidden. Progress was slow and resisted. The dawn of change. The Renaissance slowly challenged medieval medicine. Anatomical study improved. Observation replaced superstition. Trial and error began to matter more than tradition. But progress came at a terrible cost. Millions suffered and died before medicine evolved into something safer. Conclusion: healing that harmed. Medieval medicine was not just primitive, it was often lethal. Doctors acted with confidence, authority, and profound misunderstanding. If you lived in the Middle Ages, survival depended less on treatment and more on avoiding it entirely. The nightmare of medieval medicine reminds us how fragile life once was, and how hard-won modern medical knowledge truly is. If this deep dive into history disturbed and fascinated you, like this, subscribe for more dark historical stories, and comment below what medieval practice, disease, or era you want explored next.